life's a journey. Along the way, earn toward a new
Be normal, I wanna be sane. I wanna look at you and feel something other than pain. I need shelter, safe haven. I want a quiet place to go and wait out the rain. I want a woman, I want a job. I got an itch coming on again, trouble again. I wanna wake up and feel love. Will you look me in the eyes, tell me I'm not dying? I'm losing it.
Okay, hi. How y'all doing today? I hope this is recording. I think it is. Let me see. I assume it is. All right. So today we're going to start talking about disorders. And a couple things just to kind of introduce the topic. First of all, students a lot of times will read this chapter and decide they have all the disorders. Don't do that. It's like WebMD. You get on there, you're convinced you have everything. So be careful about that. What is going on here? I cannot see this. All right. Oh, there we go. All right. So the other thing I want to talk about is, maybe you'll listen to this chapter and you will be convinced that something you talk about is fairly close to what you're experiencing. Disorders are a function of the extremity of the symptoms, the collective pattern of the symptoms. So if you just have one symptom, that probably doesn't mean you have a disorder, but you have to have a collective pattern, intensity, and the duration of it. So I'm going to be starting by talking about anxiety disorders. And as I talk about them, I'm going to put them on the screen, but I'm actually going to talk about anxiety disorders pretty quickly. So if you want to read, what I've put up are the diagnostic statistical criteria for different disorders. So if you want more detail, pause the video for a second so you can read the screen, because otherwise I'll be kind of going through them pretty quickly. So anxiety disorders, of course, what they all have in common is anxiety. And the first one we're going to talk about for a minute is generalized anxiety disorder. And generally what you're going to see if someone has generalized anxiety is that sympathetic nervous system that we've talked about so often is at a heightened level, and it's kind of all the time. They're constant worriers. They worry about things that maybe other people don't. It's almost, it would look to an outsider like they're looking for things to worry about, when in fact it's probably biologically and internally driven, that they have this nonstop sense of anxiety. So they're always kind of edgy and restless. They just have this constant state of anxiety and worry, and it doesn't have to be attached to a specific thing. And that is in contrast to what we call panic disorder. So panic disorder is not so much a constant state of anxiety like generalized anxiety disorder is, but when you have anxiety, it is super intense because you have what are called panic attacks. And here are the symptoms of what a panic attack is. So the person's sweating, they're probably turning pale, they might be having trouble breathing. They often report they think they're having a heart attack. They feel like they're dying, and they have a fear of dying. Often with the first onset of a panic attack, they go to the hospital because they literally think they're having a heart attack. And so unlike with generalized anxiety disorder, where you wouldn't see anything physically going on with the person, with a panic attack, you could probably tell from the outside by looking at them that they were having a panic attack. They wouldn't be able to kind of talk. They'd have breathing problems, sweating, and so on and so forth. Now, the really kind of evil thing about panic disorder is that these panic attacks come on at random. So you never know kind of when they're gonna hit. So one day you're wandering through the middle of Walmart and bam, a panic attack hits. And it might be while you're driving or so on and so forth. So think about what it would be like to live with this knowledge that randomly you're going to have a panic attack. And so what often happens to people with panic disorder is they develop agoraphobia. Now, people mistakenly think agoraphobia is fear of going outside your house. That's not what it is. it's a fear of being in a situation that you can't control and you can't escape from. So going back to panic disorder, you're in the middle of Walmart, you're having a panic attack, people are looking at you, you can't control the situation. And so eventually people with panic disorder often just like to stay at home in their safe place where they can control the environment and what's going on. So often you'll see panic disorder with agoraphobia. So again, remember, agoraphobia is not fear of going outside your house. It's fear of being in an uncontrollable situation, being trapped in a situation you can't get out of. Okay. Then specific phobias. Boy, there's a million of them, and I've given you a couple really great ones in terms of the videos. You really should look at the videos I posted because they really illustrate a lot of these. But I gave you one for a phobia of clowns, and I gave you one for a featherophobia. And so, again, essentially kind of have a panic attack in response to a specific trigger. With generalized anxiety disorder and panic disorder, there's no specific trigger occurring in that situation. And I could have this on a little better setting. Okay, so social anxiety disorder. You have a fear of being judged, being negatively evaluated, being embarrassed in front of people, so much so, it's so extreme that you just avoid social situations to a greater degree than other people do. We all don't like to be in social situations where we don't know people or we're worried about embarrassing ourselves, but this is just such an extreme that their life is altered by it, that they truly are so afraid of it that they won't engage in social interactions. Sometimes they might have a person or two they feel comfortable around, but in general, they avoid social situations. Okay, obsessive compulsive disorder. So there's two parts. There's obsessions and there are compulsions. Obsessions are these, as it says, recurrent persistent thoughts. So it's these unwanted thoughts that you cannot control, and they happen over and over again. So the stereotype is often germs, right? So you're sitting there thinking about germs. I had a student years ago who had a severe case of obsessive compulsive, and it was germ-based. So she'd come to class, and you could just tell she's worried about germs. She's thinking about germs, as we all are now, kind of. And so she would engage in these compulsions. Compulsions are repetitive behaviors that reduce the anxiety that is caused by this obsession. So she'd be in the middle of class, and she'd pull out a can of Lysol and clean everything around her. She wore gloves. You couldn't touch anything of hers, so on and so forth. Other examples of obsessions are things like if things don't happen in even numbers, something terrible is going to happen. There's always this sense of something terrible is going to happen if I don't do the compulsion. So if I don't do things in sets of 3, something terrible is going to happen. So they have to do everything in sets of 3. So often there's counting behavior, checking obsessions, checking behavior. And the compulsion, the behavior, is always an attempt to reduce the anxiety that was caused by the obsession. I had another student with these terrible obsessions about he was going to do something horrible to family members and loved ones. He was going to kill them, stab them, but he never would. People with OCD are not at all a violent group, so they have these terrible thoughts when they would never act upon them. So you can read the rest of those to kind of get a sense of those. All right, let's go on to the next one. Sorry, didn't mean to get out of slideshow. Let's get to the next one. Okay, post-traumatic stress disorder. Boy, this is like a 4-page one because there's so many criteria for them. So the person has to either have been specifically directly exposed to a trauma, be it a natural disaster, sexual assault, war, things like that. Or they have to watch it happen to somebody else, or sometimes it can happen through indirectly learning about it. Okay. A lot of times it's professionals, EMTs. I know I've had students that are ambulance drivers that have post-traumatic stress disorder by seeing the horrible things that happen to others. Police officers have it a lot. Okay. So then they have to start having these various symptoms, okay? At least one from criterion B, nightmares, flashbacks, distress, unwanted or upsetting memories. They have to have one of these, that they have trauma-related thoughts or feelings, or they get triggered by external reminders, that they have an inability to, they either have repression or they think about it a lot. They have negative emotions. They have difficulty with positive emotions. Okay, so you have to have 2 of these to have PTSD. And then you have this last kind of set where you have these kind of characteristics. Hypervigilance means you're constantly on guard. You don't want anybody to come up behind you from the back. You're easily startled. You can't sleep. You can't concentrate. Okay, and that they have to last for at least a month. Okay, and have to be significantly impairing either your social relationships or your occupational things. So huge divorce rates for soldiers with PTSD, because they can't feel anything positive. It totally disrupts their family relationships and their social relationships. So terrible disorder to have to deal with. Here's even more of those kind. Oh, I'm sorry. And that, I think, is the end of anxiety disorders. Yeah, that's the end of anxiety disorders. So I'm going to pause there.